the city's most diverse area is also our most ignored. And although we make up more than 25% of the population, we get less than 1% of the hospital donations. How is that equal health care? We need you to back us.
Love Scarborough is a campaign by Scarborough Health Network shedding light on healthcare inequities within the city. To tell us more is Chief of Staff at Scarborough Health Network, Dr. Elaine Yeung, and cancer survivor and grateful Scarborough patient, Fiona Kingsley Boyer. Welcome. Thank you.
Thank you.
And thank you for wearing the colors of Trinidad and Tobago today. We all got the message. Faiza, you didn't get the message on that one, but that's okay. Now, I'm familiar with the Love Scarborough campaign. I've got a hoodie and everything. I've had the privilege of working with you guys on this campaign a little bit. I was kind of floored by some of the stats that came out, and some of that was in the video. But Elaine, tell us a little bit about Love Scarborough and what the Scarborough Health Network is doing for the community.
Yeah, thank you so much for having me. And the Love Scarborough campaign was launched to shed light on the inequities, health inequities in Scarborough. Essentially, about 25% of the Toronto population lives in Scarborough, but we only get 1% of hospital donations.
That's amazing. I had no idea. And that's out of all the hospitals in Toronto?
Yes.
Wow.
And the important thing to know is that we have some of the best physicians in the province, some of the best surgeons, and they're still working in the oldest operating rooms in Ontario.
Scarborough has the oldest operating room in the whole province?
In the whole province,
Which one is that at?
Scarborough General.
Scarborough General, the round one, for those of you who know, the round building, yes. And Fiona, you know, you are a cancer survivor. So tell us a little bit about how Scarborough Health Network has helped you and your family during that time.
Absolutely. Thank you for having me. As you mentioned, I've lived in Scarborough my whole life. And 4 years ago, when I was 32, I was diagnosed with cancer, Hodgkin's lymphoma, and I was also 4 months pregnant at that time. Wow. And I underwent life-saving treatment at Scarborough Centenary Hospital. And the treatment I received was like I was getting care from my family. And what I mean by that was my mother, who doesn't speak English, Tamil is her first language, she was able to converse with the physicians and nurses in her primary language. And that's the case for a lot of the community in Scarborough. 60% of Scarborough residents are new immigrants, and 50% actually speak a primary language other than English at home. And, you know, Scarborough tends to get a bad rep, but I'm so proud of the Love Scarborough campaign, you know, and networks. I've got to show Love Scarborough in such a great light and let Scarborough residents be seen in such a good light, finally.
Right. And it's the 3 hospitals that make up the Scarborough Health Network, right? So it's Centenary, where I was born. It's Scarborough Gen, which is the round one. And Birchmount, where, funny enough, it was my second job. I worked there when I was 17, 18 at what used to be Scarborough Grace Hospital at the walk-in clinic. So I'm very familiar sort of with the healthcare in Scarborough, being born and raised there myself. So very proud. And you're right, there's so many sort of communities to cater to, and I think Scarborough does it really well. And isn't there something as well where you're training up sort of the next generation of physicians?
Oh, for sure.
In that region, right?
For sure, for sure. So we're going to have a new medical school in Scarborough. It'll be amazing. It's with the University of Toronto. And we're going to be training about 30 medical students a year, starting in about 2 years' time.
Wow.
And also going to be training nurse practitioners, physician assistants, and about 1,000 life science students. So it's a real opportunity. When you train people in Scarborough, they tend to stay in Scarborough as well as to join our healthcare team. And this is something we're so proud of. And just to let you know as well, I went to high school in Scarborough, Sir John A. Macdonald Collegiate Institute.
You guys had good fashion shows.
Yeah, exactly. and I went to, really owe it to my teachers, I went to Harvard for my undergrad, but I chose to come back to Scarborough because I so believe in our community. We have a very diverse community. We're doing such great work. And, you know, really counting on everyone to support us.
And I know what you mean about Scarborough getting a bad rap, right? Like growing up, I was always like, okay, well, I'm from Scarborough, and then you get all the all the jokes and all the comments.
Exactly. But this campaign is really putting us in, you know, the positive light and showing all the excellence in Scarborough, and it's giving a chance for Scarborough residents to be seen. Finally.
It really is. And Giving Tuesday is tomorrow. Where can people go to help support this?
It's very easy. They can donate by going to LoveScarborough.ca. So can donate online and also learn about our important programs like mental health. We're building a new emergency department, best kidney dialysis program in the country.
Big things, big things going on. So Love Scarborough all the time. Thank you so much.
Thank you so much.
Both of you for being here today. Faiza's got your headlines coming up next on BT.